Hello and welcome to the Cancer Education Series, brought to you by MercyOne and Above and Beyond Cancer. Tonight's session is brought to you through a grant made possible through the Iowa Cancer Consortium. My name is Chris Goodale and I'm the Executive Director of Above and Beyond Cancer. And it is my pleasure to introduce Dr. Richard Deming, who is the founder of Above and Beyond Cancer and the director of the MercyOne Cancer Center. Dr. Deming?
Great, thank you, Chris. And it's my honor to be here tonight. And instead of a lecture, we're going to do a conversation. And I'm here with Izzy Fidler. And is it Fidler or Fiddler?
Fiddler, like on the roof.
Fiddler, but only one D.
Yes.
So Izzy is a oncology nurse. And, you know, I have to admit, most of the times when people think of cancer and think of medicine, they think of doctors first. But nurses play such a vital role, and I would dare say in many patients' cancer journeys, the nurses play a more important personal role than the doctors do. Izzy has been an oncology nurse for about 2 years, and she is, ever since graduating from Mercy College of Nursing, she has been an oncology nurse on our inpatient oncology floor. And we thought it'd be a good conversation to just talk about the role of the oncology nurse in the cancer journey. But Izzy, before we start, I have a little tribute to you. So anybody watching knows that one of my favorite authors is John O'Donohue. John wrote this beautiful book, and I'll give you a copy. It's called To Bless the Space Between Us. And it's a book of blessings that are kind of like a combination of poetry and prayer. And John O'Donohue actually wrote a blessing for the nurse. And this is John O'Donohue's blessing for a nurse. In this fragile frontier place, your kindness becomes a light that consoles the brokenhearted, awakens within desperate storms that oasis of serenity that calls the spirit to rise from beneath the weight of pain, to create a new space in the person's mind where they gain distance from their suffering and begin to see the invitation to integrate and transform it. May you embrace the beauty in what you do and how you stand like a secret angel between the bleak despair of illness and the unquenchable light of spirit that can turn the darkest destiny toward dawn. May you never doubt the gifts you bring. Rather, learn from these frontiers wisdom for your own heart. May you come to inherit the blessings of your kindness and never be without care and love when winter enters your own life. So a beautiful poem for the nurse who is an angel of mercy. And you come from a long tradition, Mercy, and the tradition. Do you want to maybe share with the audience the tradition of the Sisters of Mercy and how that started and sort of the tradition that you carry on?
Oh my gosh. I mean, I know like Mercy was created back like, I think 1899 or something like that when Mercy was started. It was a bunch of nurses, and the reason that they are located where they are in downtown Des Moines was because that was the area with the greatest need. And so that's where they decided to kind of set foot and be able to provide care for their patients. Yeah, just to best them and to be located right there.
And Izzy, as you know, Sister Catherine McCauley began this Sisters of Mercy in Ireland and actually started giving ministry to women and children. And out of that tradition in Ireland came the Sisters of Mercy, and that's how Mercy got started. So what happened to you in your life in grade school and high school that led you to decide to go into nursing as a calling?
Well, I have known I wanted to be a nurse probably since I was like 10 years old or so. I was talking with Chris earlier. So my grandfather, I mean, all of us have been affected by somebody who's been diagnosed with cancer. And the reason that I really wanted to go into oncology nursing was because my grandfather was up on 8 South back like 13 years ago when he was doing some of his cancer treatment and everything. So I just kind of fell in love with going up there and helping him and, you know, taking care of him. And my grandmother still to this day talks about how amazing the nursing staff was that took care of him. And I, you know, I wanted to find a profession and something that 13 years later, even though he may still not be here, she still remembers how people treated her and him as well and how they took care of him.
Yeah. And so 8 South is the oncology ward at Mercy. And so how old would you have been when your grandpa was in the hospital?
Gosh, I think I was, oh my gosh, probably 10 when he was diagnosed, either 9 or 10. So.
And is there any particular memory you have of nurses taking care of grandpa?
Oh yeah, I mean, I would remember walking into the room and they all loved, he would walk down the hallway in his plaid pajama pants and, you know, he would say hi to everybody and kind of everybody just loved him. And still, I mean, some of the nurses I work with today still remember him as a patient. So that's always wonderful to hear.
Mm-hmm. So you graduated from high school and you entered Mercy College of Nursing. Tell us a little bit about what it's like going through nurses training.
Nursing school is very hard. That's one thing that I can remember. You have to be very dedicated and very motivated to want to learn, just because one day, you know, you're going to be taking care of somebody's life. So making sure you studying as much as you can and getting as much experience as you can. I worked very hard to get to be where I am today, and I'm very proud of myself. But it was very challenging.
What was your most difficult classroom subject?
Oh my gosh, probably I would say maybe like critical care. We did like some ICU. That's just not my passion, or like mom baby, you know, some like obstetrics and everything. Those were my hardest classes just because I worked so much in the medical surgical, you know, adult population that was hard to wrap my mind around.
What about, did you have to take like organic chemistry or biochemistry?
Oh my gosh, thank goodness. So we had to take microbiology and that was challenging too.
Okay.
Yeah.
What was your favorite class in medical school?
I loved pharmacology. I find like chemotherapy super interesting up on the floor. So it was interesting kind of learning different drugs and the side effects and what they do and what they're used for. I really enjoyed that class.
And do you remember your first day as a real nurse, not a student, but on the paycheck as a real nurse, and the first patient you were assigned?
Oh yes. Oh my gosh. Yeah. I remember the first patients that I took care of and I was so nervous. You know, it was very much like this was real life and everything that I'd worked hard to get to. Yeah, I remember walking in and you could kind of get the sense that I was a little on edge and not as confident, and taking a blood pressure and my hands are shaking even though I'd done it a million times before. It was just a very different perspective to have.
So nurses do a lot more than take blood pressure and hand out medicine. And being a nurse is really a human being taking care of another human being. So what are some of I kind of put the work that nurses do into several different buckets. There's the physical care you provide the patient, the emotional care, psychological care. Tell us a little bit about some of the challenging or some of the regular sorts of things you do in terms of the physical care of a cancer patient and how that might differ than other medical surgical floors.
Yeah, so cancer patients are very much kind of a different type of patient to take care of. They're much, I think, sicker than most patients would see, you know, like on an inpatient setting. We're administering chemotherapy to patients on that physical side. You know, you're not handing that out to everybody. You have to take special care because they are immunosuppressed. They have weaker immune systems. So making sure that you're washing your hands diligently, you know, wearing those gloves, making sure you're not sick when taking care of them. You know, they really do require a little bit more work from the nursing staff, making sure that they're getting, you know, your bathing and stuff. Most of them have central lines with direct access to their heart. You know, you need to make sure those are staying clean, as to not have any infections or anything going on with them. So that's just a little bit about what we do with those.
Yeah. And as you know, one of the distinguishing characteristics of cancer is that when patients hear the word cancer, they hear as part of the word cancer, oh my gosh, I might die. And mortality is kind of present in the room with every aspect of caring for cancer patients. How does the idea that you're taking care of patients that have a serious illness where their life is on the line, how does that affect the way in which you care for patients?
I think it's very much of kind of taking it day by day. You know, you want to make sure that today is today, tomorrow's tomorrow, and living each day as best as you can. Sometimes you're not going to feel the very best, and that's totally okay. But just kind of providing compassion as best as you can, actively listening as best as you can, because I don't know what it's like, you know, to have that sort of diagnosis, but sometimes you need just a listening ear for somebody to be able to, you know, talk to you about what's kind of going on. And we do see it very frequently up on the floor with all of our patients. So it's nice to know that they're not alone and that you have somebody who may have experienced it from an outside perspective that can kind of help you out during those times and just kind of be there to help support them as best as possible.
So Izzy, I am a real fan of joy. I, with all my patients, try to bring out of them what provides joy to them. And I would also say that with every interaction with every one of my patients, I try to instill some joy into them. And I would say, in terms of joy, can you think of how you interact with patients that you make their day more joyful by the way you take care of them?
Probably the first would be my attitude. I really love my job, and I hope that comes off in the presence of patients. I'm always, you know, I'm the bubbliest person on the floor. You know, I'll walk into a patient's room and they're like, oh, there's that bubbly one again. And I do like to smile, and you'll very much see me being the cheerleader in patients' room, cheering them on as they're getting their, you know, their treatments. And if they're walking in the hallway, you know, just kind of clapping and making sure that they know that they're doing great. They're helping themselves in the best way possible. So that's probably how I, instill a little bit of joy.
Yeah, I mean, just you walking into the room with that smile of yours,
Yes.
I can tell you that gives joy. And to be just a real person talking to another real person and expressing empathy is so healing.
Mm-hmm. Yeah. You don't need a prescription for compassion. So you just kind of need to be there and listen.
Whenever I'm with medical students, I always really tell them, you know, you have the power to heal just by being present. And it really is a power to heal if you just let yourself shine and interact patient to patient, human to human, I mean.
Yes, I totally agree.
Yeah. So you obviously provide a great deal of physical care in terms of caring for the body and providing medications. Talk a little bit about the emotional and psychological care you provide for patients.
Oh, yeah. And definitely that has changed with the course of COVID. I mean, it's just been kind of such a crazy time with like this global pandemic. Emotionally, I always tell my patients I'm always there if you need somebody, you know, a shoulder to cry on, just because you go through such a wave of emotions from beginning of diagnosis, as you know, you're receiving treatment, and we tend to move very quickly with everything, just because we just know that's how you treat cancer, is you need to move fast and kind of act on it quickly. And that I'm always there if they need to talk, no matter what, and pulling up a chair just to sit there and listen to them. I try and be positive. That's usually the best to help them emotionally. And just because you don't want somebody to come in that's such a Debbie Downer, you need kind of that hope and that positivity to be able to continue to keep fighting and to keep going.
And I bet you also play a vital role in terms of communication and if you will, translation. Maybe talk about, sometimes I'm sure you're in the room when some doctors come in and are giving information or knowledge or results, and they leave the room, and you probably end up being the translator to really, what did they say and what did it mean? Can you talk a little bit about the way different doctors communicate, and then how the nurse also plays a role in terms of communication and or translation of the doctor's
Oh yeah. Oh gosh, all the time. You know, we do have to kind of simplify terms a little bit. Yeah, and especially when doctors, they round pretty early in the morning most of the time, and people are halfway awake and they're looking at you like, what did they just say? Like, what's gonna happen today? You know, they'll say different tests where you have to kind of say, oh, this is how the test is gonna look like, and this is what they're gonna do, and just kind of creating that plan. Oh yeah, we're very much the translators and interpreters, so to speak, just to kind of simplify terms. And different doctors kind of come in there. Some are very, very confident, speedy movie, and others are very slow to speak. So you kind of just have to take what you can and just kind of deal with the cards that you got.
Yeah, and medicine is a team sport, if you will. There are lots of team members. So let's say a patient's in the hospital on the 8th South, and they have cancer and they're getting chemotherapy, and maybe they'd also had surgery and they've got lines and they've recovering from some debilitating. Who are some of the other team members that come into the room on 8 South that help in the overall care of the patients? Besides the doctor and the nurse, name some other team members that are important to caring for a patient who has cancer, who's in the hospital.
Yeah, so a lot of it, we have a lot of nurses aid. We call them patient care technicians. So they're kind of there to help with your like activities of daily living, get you up to the bathroom, get you a shower. They're truly the most amazing people, and I love everyone that I work with. A lot of the time we'll have physical therapy and occupational therapy, so they're helping you get stronger, also helping you, you know, with those daily living activities. We have the phlebotomists, also known as the vampires, that come in bright and early, 4 a.m., turn on all the lights to wake you up and take your blood, but, you know, we're needing to monitor your lab work, and that's a super important part of your care. I mean, that's probably the majority that you'll see on the day-to-day basis.
Yeah, and other people that I can think of, you can maybe comment on pastoral care. We've got chaplains.
Yes.
We've got social workers. We've also got palliative care team members. And do you, as a nurse, have the ability to bring some of those team members on, or do you have to wait till the doctor writes the order?
Oh, like pastoral care, we can always call. Social worker, we have a patient care manager too that helps with all of that. And we actually do meetings daily, Monday through Friday at 10:30. We plan your discharge when you get admitted. And they're there. We're talking continually about your care to be able to make sure that any bumps in the road that we might hit at your discharge, we have everything kind of planned and squared away. So social work we can bring in right away. Palliative care, most of the time we have to have a consult from the physician to have that team come on. But normally we have, nursing is a very independent practice, which is nice, is we can bring in all those people to kind of help.
Yeah. You mentioned COVID, and obviously we are going on almost a year now with different policies and procedures and ways of dressing and ways of taking care of patients and different rules about who's in the room. Maybe talk a little bit before COVID, the role you played in taking care of the family of patients and that communication and actual the care you provide for family members. And can family members stay overnight in the room? How, let's say pre-COVID.
Pre-COVID, yeah, we would have tons of family members up on the floor, and they, most family members would be there 24/7 with the patient. We do have some bigger rooms on the floor, which is super nice, where we can have families stay in little kitchenettes. So patients who may have to be there for a long time are able to kind of have those resources. Yeah, I mean, your patient's family members also become your patient a little bit. You're taking care of everybody, and especially with like a cancer diagnosis, you're having to help their emotional needs as well as their psychological needs, just because, when a family member is diagnosed with cancer, it's kind of like everybody's a little bit diagnosed with cancer, and you need to make sure that they're receiving the same exact support. Because you can see a lot of times a caregiver role strain or caregiver stress. You never want that to happen, because you want them to feel supported and cared for just as much as your patient. But yeah, we had patient family members up all the time, and communication was well, because doctors would walk into the room and they'd be able to talk to everybody, and the nurses were continually communicating with the family members. So it was really nice.
Talk about, if you will, some of the challenges that you face in certain situations. So whether it is patients who speak a different language, patients who have a different culture, patients who maybe don't have any family with them. Maybe think of a particular patient, and obviously without saying the name, kind of describe a challenging situation and kind of how you can make a difference in their lives.
Yeah, and we currently have a patient right now who does not speak English. She speaks Farsi, which is like a Persian language. And not many people probably speak Farsi compared to other languages. So that's been a huge challenge in getting to know that patient personally. And we're very fortunate at Mercy. We have, it's called a Marty system, and it's an iPad where we can have interpreters, like video, kind of like Zooming a little bit. They're able to communicate with the patient, which is, been super awesome, and kind of just getting to know them, and, having that extra, instead of sitting on a phone call with somebody trying to translate, you have another person there who's able to do that. So that's been a very challenging. And we do get patients from all types of different cultural beliefs. And just you really have to take it with stride of getting to know them as a person and being able to respect those boundaries as best as possible. We try to have cultural strong cultural beliefs, and very much support their cultural beliefs, because that's going to help them heal and kind of in this health situation. Yeah, those are just some of the things that we've had to encounter.
Mm-hmm. I know when we're taking care of patients that we're not always able to cure every patient with cancer. We can heal through various ways, but we don't always get the outcomes that we want. How do you deal with loss? How do you deal with difficulty with grief and family sadness when you check out at the end of your shift and you go home? How much of the floor do you take home with you, and what do you do to help process all of the tension and sadness and even joy that happens on the floor? How do you leave it there, or how much of it do you take home with you, and how do you integrate that into your life?
It definitely was very challenging in the beginning when I first started. I mean, I'm only 23 years old and having to deal with very real life situations that not many people my age have to deal with. And it's kind of balancing when to be tough and when to be a human a little bit. I used to take a lot home when I first started. I mean, I think anybody would. And I've gotten a lot better at kind of disassociating and just leaving, those experiences at work, as soon as you walk out of the doors, you're kind of, I'm back to being just regular Izzy. I'm not Nurse Izzy. I have wonderful coworkers. I love everybody that I work with, and I have a wonderful management team that is very supportive, and they're always there if I need to have a conversation with them or to talk with them about what I'm going, and I'm always there too if they need somebody to talk to. Because we're all experiencing it at the same time. And sometimes it's hard to find, my family and friends may not understand exactly what I deal with on a day-to-day basis. And it's nice to know that somebody's kind of in my same shoes that I'm able to talk with. But I also have great family and friend support, and they're wonderful people to hang out with and kind of listen to what I'm going through. But I try to leave work at work as best as possible, but take some of those experiences and just know that it makes you a better person, and that life is very short and you have to be grateful for everything that you have, no matter what it is.
Let's talk a little bit more about COVID. So what are you wearing at work, and how does that interfere or enhance your job?
I don't work anymore. So everybody wears masks, all of the staff. Yeah, there you go. That's exactly what we look like with the face shields and the glasses.
So Izzy, how do you smile?
I know, with your eyes. It has to go all through your eyes. Yeah, it's such a challenge. Yeah, everybody's wearing masks. We're taking our temperatures every day when we walk in through the door. And yeah, so it gets a little hot underneath all the garb that you have to wear.
Yeah, and you're right. You smile with your eyes, but I can tell you it's not the same smile. I mean,
No.
I think it's I think patients the connection we have with other humans is interfered with this. So we have to find ways of using our eyes, using our voice. You shared with me that you did theater in high school.
Mm-hmm.
And I think one's sense of ability to project emotion is an attribute in human to human communication. So tell me, how do you use your theatrical talents to help make patients feel better?
Oh gosh. I mean, it's probably just trying to come up with a bubbly attitude. Like I said earlier, I'm always that cheerleader in the room as soon as you walk in, and you know exactly what you're going to get as soon as I walk into the room. Yeah, definitely just making sure, just sending those positive vibes that they know they'll be cared for. They know that no matter what, even though they can't see my face, I swear I'm smiling underneath, and that that I truly love my job. I love everything about it, and I want to be there to take care of them and to help them get better as best as possible. Yeah, it's kind of sending all the positive vibes.
So Izzy, you mentioned you're 23. I'm 67, and the way that I take care of patients now, from the medicines we use, the treatments, they've changed a lot. And I would suggest that what you're doing now is going to change over time, and that your profession will evolve. How do you keep up on all of the changes that's happening in the world of oncology? How does a young nurse go about getting continuous nursing education?
Oh yeah, we have a great education program. And we have, great education leaders, especially like on the floor. We have continuous education throughout, specifically based on oncology, for the accreditation of like the oncology of the cancer center and everything. There's an opportunity, it's the OCN, so an oncology certified nurse that you're able to achieve, that provides, I think they even have like monthly meetings where you can go and learn about different speakers of different things related to oncology. We're getting continuous education credits, based for oncology, and we have different classes for different types of cancers that we take. So we've got plenty of stuff out there. It's been a little bit behind with COVID and everything. We're really learning the whole Zoom and how to achieve that, but yeah, it's all over the place.
What would you say are some of your professional goals?
I would love to get my OCN here. I'm hoping maybe this year I'll be able to get it. The testing, we have to take a test. Yay, right? To get that. So I'm hoping this year. I would love to further go on and become a nurse practitioner at some point. That's definitely in the future, maybe in the next 5 years or so. I just love what I do, and I want to be able to do more and to provide more for patients. Oh, that's probably.
And as someone who takes care of patients in the inpatient floor, do you have any advice for our audience who might be coming in as a patient, or advice for anyone in the audience that might be coming into the hospital to visit someone with cancer in the hospital?
Oh gosh. I would say definitely probably for patients coming in, just to have some patience with your nursing staff, patience for the patients, right? And to know that you're not alone, and we're there to help you as best as we can. I say for those who are visiting, being present with them is very important, and just being able to talk to them about, kind of everyday life, and kind of sometimes it's nice to disassociate yourself a little bit from, all the medical garb and everything that's going on. So I'd say that's a couple of things to kind of.
Yeah, my advice would be to get to know the nurse, because boy, it's not the doctor that's running the show. It's the nurse. You're there, for your entire shift. The doc comes and goes and maybe spends 10 or 15 minutes, and you're just really an angel of mercy there. Well, Izzy, any last words of advice or anything else you'd like to say before we wrap it up this evening?
I just want to say thank you so much for having me. This has been super fun and exciting and great opportunity.
I want to thank you for being on tonight, but also for having the courage to choose oncology nursing as your profession, and the way that you brighten up the floor and the way you brighten up your patients' lives. It makes a huge difference. So thank you. Thank you for being an angel of mercy.
Thank you.
And with that, we're going to turn it over to Chris, and Chris will send us out tonight. So Chris, back to you.
Hey, thank you both. What a wonderful program. It was eye-opening for me, and I was even an oncology patient, and I would agree that the nurses, from all the physical work that they all do, and just the compassion that I was given was exemplary. So thanks very much. This will be recorded, or has been recorded, and will be on our YouTube channel, which all the Cancer Education Series recordings are on there. It's fun to watch those numbers grow as people continue to watch them week after week. Again, thanks to the Iowa Cancer Consortium for being a grant provider to this great event and weekly activity. So we'll look forward to seeing everybody again next week.
Great.
Izzy, thanks again.
Yeah, thank you.
Good night.
Take care.